If you watched my earlier talk on aging legs and varicose veins, you'll remember we spoke about what our legs reveal, not just about veins, but about circulation, skin, and aging. Today, let's go a step further. What can you actually do about it? Let me say this clearly at the start, I don't treat varicose veins myself. My field is skin and skin cancers. But because I've examined thousands of legs for skin cancers over the years, I often see the same questions arising about swelling, discoloration, and those brown stains that quietly spread around the ankles. Many people tell me they're unsure what to do next, or they've only heard partial answers. So, this talk is for you: what really works and how to take the next step confidently. Let's begin with the elephant in the room. That's compression stockings or tights, the part that everyone finds hardest to love. Most people say they are tight, hot, and impossible to pull on. And yes, older versions could be stiff and uncomfortable, but compression still works, and it's the most reliable way to reduce pooling of blood in weakened veins. Think of it as external support that helps your veins do their job. The good news, however, is that compression wear has come a long way. The newer medical grade stockings use much softer materials like microfiber, cotton lined blends, or moisture wicking fabrics that breathe better in warm weather. Some designs use bamboo viscose fibers for softer, smoother feel, though those are usually for lighter support. But it works. Others weave in silver or aloe fibers to reduce odor or irritation for people with sensitive skin. If you have tried stockings years ago and hated it, don't worry, it's worth another look. They are different today. There are also open toe or zippered designs that make them easier to put on and inexpensive aids that help you slide them over the foot without a struggle. If you have fragile skin or arthritis, these little tools make a big difference. Very important practical pointers. Always get fitted properly. Compression works only when it matches your leg shape. Many pharmacies and vascular clinics measure for you the correct size and strength. You can start gradually, even wearing them for part of the day helps. Replace them every 6 months or so because the fibers in the stockings fatigue over time. And in summer, you can try lighter grades or just knee length versions. And that's often enough to get you through with comfort and helps circulation. If you notice dry or itchy skin, use plain moisturizer morning and night. You don't need to wear your stockings to sleep. You can moisturize your legs before sleep. Most people, for eczema prone or sensitive skin, look for cotton lined or microfiber styles rather than pure nylon because these breathe better and they reduce friction. If redness or irritation appears, stop and have your skin checked before resuming. And if you want brand names or specific product suggestion, just ask in the comments. I can point you to the right direction toward reliable options. Besides stockings, there are small daily habits that help your veins enormously. You still need regular walking, just regular short bursts of walking. Calf muscle exercises while sitting, leg elevation when resting, and avoid long stretches of sitting or standing still. Stay hydrated and maintain a healthy weight. Well fitted shoes and low heeled sandals improve the calf pump and make walking easier, something many people don't realize. For the skin itself, keep it comfortable and intact. Moisture often treat small scratches promptly and don't ignore areas that look dark, thickened, or shiny. These may signal chronic venous changes and potential ulcers. If you notice a sore that doesn't heal within a couple of weeks, see your doctor for a proper review. When it comes to treatment options, medicine has moved well beyond the old surgical vein stripping. Today, there are several minimally invasive approaches: sclerotherapy, fine injections that close small veins, endovenous laser, or radiofrequency ablation, which seals the larger veins through a tiny catheter under local anesthetic, and medical adhesive or glue therapy, a newer walk-in method that doesn't need heat or general anesthetic. These are usually done by vascular or vein specialists after an ultrasound assessment of your leg circulation. Your GP, your primary care physician, can refer you for that scan and help you decide if specialist input is worthwhile. Even if you're not ready for a procedure, knowing your options helps. You can make informed decisions later. Here's something reassuring. Even without intervention, many people manage their veins comfortably with good skin care, movement, and modern compression wear. The aim isn't perfection, it's comfort, confidence, and prevention of complications. So, where does this leave you? If you have visible veins, swelling, or pigmentation, start by maintaining healthy circulation and skin. Try updated, the modern versions of compression stockings, even lighter ones, but they must be medical grade. They must be fitted to you, not off the shelf. Ask your GP, your doctor, about an ultrasound if symptoms persist, and if needed, a referral to a vascular or vein specialist that can guide you through the options of the less invasive treatments now available. I often remind my patients, caring for your legs isn't vanity. It's part of caring for your whole circulation. If this talk has helped you understand your options, you might like to revisit my earlier video, Aging Legs and Varicose Veins, and what they reveal about your health. Or explore my other No Hype Health Talk episodes on itchy skin, vitamin skincare, and aging nails. And if you'd like to know more about specific stocking types or brands, leave a comment below. I'll include some practical pointers there. Because healthy legs are more than just a cosmetic issue. They're part of your mobility, your confidence, and your daily comfort.